So we used to just say, you know, look, I'm a surgeon, I'll take care of your surgery, and then I'll pass you on to somebody else, and they'll take care of that, and then they'll pass you on to somebody else. And we found that, one, we weren't getting the best outcomes. We as a whole medical community were not getting great outcomes by just saying, here's my little world of your care, I'll take care of this, and we weren't even sure, other than saying, I'll push you on to somebody else, if that actually was being accomplished.
It's not just the building and the fact that all of the services are here for their convenience, but it's also a great way for our physicians to be constantly connecting on those patients that are treated in multiple areas.
We have medical oncologists, hematologists, radiation oncology, which do the radiation component of treatment. Then we have very important certified registered oncology nurses. These are nurses that do administer chemotherapy.
At the cancer team, we really try to pull everybody together into one spot. It makes it easier for the patients to know one parking lot, one entrance, one front desk staff. And we bring all the physicians together out at the cancer team, and so it doesn't really matter who they're seeing. They're coming to the same familiar place. And then if the patient is seen and we have a question, the other people are on site that we could run down the hall and talk to them. I feel like patients get a more efficient level of care with less delays, or we'll get back to you on that.
Our staff is highly trained. We have oncology certified nurses present in both areas of the clinic, and they are very compassionate. They're highly engaged. They like what they do.
It's not very often that nurses come into oncology thinking that they're going to stay in oncology, but what's well known is that that's exactly what happens. Seldom do nurses who come into oncology leave it as a profession. And it's something about the nurses, it's their senses of humor, it's their compassion and understanding and empathy that they have for the patients. They just have this ability to sort of wrap their arms around the patients and each other over the years, you know, support one another. So it ends up being your home away from home.
The team approach used at the cancer team is every patient who enters the Belling Cancer Team gets paired up with a cancer coach, who is a nurse with special training in cancer care. This is the patient's buddy for their entire care session. If they have questions about appointment times or need to rearrange appointments, or what did the doctor say, I have some questions, the nurses are literally paired up with that patient, and every visit that patient has with a provider at the cancer team, the nurse is in that appointment with them.
Nurses here develop those relationships with the patients and really become advocates for them. Patients will tell more to their nurse than they generally do to the physician. So once we get them back in the treatment area, you know, other things will come up, and the nurses, you know, will have that interaction with the physicians. We also participate in our weekly chart rounds.
Nurses are instrumental in taking care of cancer patients. We are getting better and better outcomes every year with cancer care, but it requires a very extensive approach, and sometimes it can be absolutely overwhelming for the patients. The nurses step in, they make sure I joke, all the I's are dotted, the T's are crossed, the patients are reassured about their plan for care, and the nurses really help make all that happen.
I think one of the things about our team is the fact that we're a team. So we share about 40% of our patients between radiation oncology and medical oncology. So there's lots of interaction from staff on both sides. And really the staff has the patient care is their primary focus.
We have a very good team here. Our nurses, oncology nurses, are wonderful. They are trained in this field, and it's not easy to be oncology nurse. These nurses, patients become their friends and family because you see them every week, you see them sometime every day for months. They are here 5-6 hours a day, they're getting treatment. So we have very good, compassionate team.
How would I want to be treated if I had cancer? I'd want experts on board, I'd want lots of resources and support, and I'd want efficiency but thoroughness in my diagnosis and my care. And I really think Belling has worked through that, and to use someone else's words, we treat Belling cancer patients like they're our family.